Now, the peripheral nervous system is also important in controlling responses that can bypass the brain and brainstem, which are called spinal reflexes. Okay, below the 12 cranial nerves are 31 sets of spinal nerves, all of which are mixed because they are fusions of nerve roots from the efferent and the afferent branch. Okay, the afferent branch, of course, is all sensory neuron fibers, and the afferent branch, or the efferent branch, is all motor fibers. Okay, and so what happens is that they fuse to form the spinal nerves, which then in the cervical, brachial, lumbar, and sacral region form nerve plexuses, which you can see here. Okay, and then along the bulk of the thoracic and upper lumbar, we form intercostals. Okay, um, and those are going to go between the ribs and serve structures in the posterior and anterior body wall in that region. Okay, there's a total of 8 cervical spinal nerves, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Okay, the coccygeal is termed C0, right? The 5 sacral above it emerge between S1 and S5, the 5 lumbar between L1 and L5, the 12 thoracic from T1 to T12, and the 8 cervical from C1 to C8. Okay, and these are designations for the vertebrae that correspond to the nerves that come out between the intervertebral foramina. Right. Note that there's only 7 cervical vertebrae, but 8 pairs of cervical spinal nerves because one exits underneath C7. Okay, so there is again one above C1, above C2, C3, C4, C5, C6, and C7, and then there's one below C7. The remaining spinal nerves are named for the vertebrae that is above them. Okay, so for instance, the the second thoracic spinal nerve exits below the second thoracic vertebrae. Okay, we talked about the fact that the ventral and the dorsal roots fuse to form these spinal nerves, and as a result, all of these are mixed nerves. Okay, they exit through the intervertebral foramina, and that's one of the reasons why the curvature of the vertebral column is critical in the normal function of the spinal nerve, because if there is an abnormal curvature, the amount of space that's provided for the spinal nerve to exit um, is impinged, and you can pinch or damage the nerve, and as a result, interfere with its function. Okay, and so this type of problem is usually dealt with by osteopaths and chiropractors, and methods include surgery and bracing and physical therapy. Okay, what you're looking at here is a transverse section through the vertebral column with spinal cord included, and you can see several important features. Right, in the interior, you've got the interior gray matter, which is characterized by a dorsal and a ventral horn, and then the thoracic and lumbar spine, a lateral horn. The ventral rootlets, which fuse to form the ventral root, okay, carry efferent information, motor information out, and then the afferent rootlets to form the dorsal root, which then passes by the dorsal root ganglia. These ventral and dorsal roots fuse to form the spinal nerve, which immediately is going to branch and anastomose. This is the dorsal ramus that wraps around to the back of the body, the ventral ramus that comes around to the front. These are the paravertebral ganglia, and they're a feature of the sympathetic division of the autonomic nervous system. And these are the communicating rami that branch on and off of the spinal nerves and serve as ways to allow the preganglionic neuron of a sympathetic efferent neuron to synapse onto a postganglionic neuron that heads out to its target. Okay, and we'll learn more about that when we talk about the autonomic nervous system. Okay, this is the body of the vertebrae. Um, this is the ventral median sulcus and the ventral median fissure and the dorsal median sulcus. This is the great commissure, and that's the central canal. Okay, and these, of course, are the intervertebral discs. Note that the spinal nerves are very short, all mixed. Each is going to branch into a dorsal and a ventral ramus. The ventral ramus is larger than the dorsal. There's usually a meningeal branch that re-enters the vertebral canal and innervates meninges and blood vessels, and the rami communicans, which we already discussed, were part of the autonomic nervous system. All the ventral rami, with the exception of those that come off from T2 through T12, form these nerve plexuses that we discussed earlier in the cervical, brachial, lumbar, and sacral regions. These are nerve nets, which are combinations of both efferent and afferent nerve fibers and autonomic and somatic nerve fibers. The back is innervated by the dorsal rami, while the ventral rami of T2 through 12 are intercostals and supply muscles in the ribs and the thorax and abdominal wall. The spinal roots become longer as we move inferiorly in the cord, terminating in a cluster of nerve leads called the cauda equina, which is basically a shorthand for horse's tail, and those innervate structures in the pelvic region and in the lower limbs. And what you're looking at here is just a diagram showing you where these rami are, okay, and a cross section through the vertebral column and spinal cord in the middle, okay. So this would be taken at the level of the thoracic cavity, okay. Note the sternum in the front and the vertebral column in the back there. Okay. Within the plexus, note that the fibers crisscross. Each branch has fibers from several spinal nerves. The fibers from the ventral ramus go to the body periphery through different routes. Each limb muscle is innervated by more than one spinal nerve, so the damage to one doesn't result in complete paralysis. Our first nerve plexus is shown here. The cervical plexus is formed by the ventral rami that come from spinal nerves C1 through C4. Most of the branches form cutaneous nerves that innervate skin in the neck, ear, the back of the head, and the shoulders, and other branches are going to innervate neck muscles. The most important nerve coming off here is the phrenic nerve, which innervates the diaphragm, which is the main muscle of breathing. This gets fibers from C3 through C5. Irritation of this nerve can cause hiccups. Now, an important way to remember this nerve plexus is the mnemonic, let our great aunts take certain super privileges. So this stands for greater auricular, lesser occipital, the phrenic, and the supraclavicular. Okay. And then for the phrenic nerve, remember that the nerve roots C, 3, 4, 5 keep the diaphragm alive. So some more mnemonics for you. Okay. Here you can see the brachial plexus, which is formed by the ventral rami from C5 through 8, as well as thoracic 1. It gives rise to nerves that innervate the upper limbs. The major branches of this plexus are roots, trunks, divisions, and cords. Okay, so how to remember this? Well, the mnemonic for roots, trunks, divisions, and cords is real tired, drink coffee now. The mnemonic for the nerves that come off the brachial plexus that you need to know is my aunt rammed my uncle, which stands for musculocutaneous, axillary, radial, median, and ulnar. you can see the way that the roots, trunks, divisions, and cords anastomose and branch in this diagram. Okay, I just want you to appreciate the fact that this nerve web results in nerves that feed their targets that can be any combination of nerve roots that are both sensory and motor. Okay, so both afferent and efferent fibers can be within a particular nerve. You can see the nerves that we've discussed here innervating their targets. The axillary nerve innervates the deltoid, the teres minor, and the skin and joint capsule of the shoulder. The musculocutaneous innervates the biceps and the brachialis and the coracobrachialis and the skin of the lateral forearm. Okay, and the median nerve innervates the skin, most of the wrist flexors, the forearm pronators, and the wrist and finger flexors, as well as the muscles that are responsible for opposition of the thumb. Okay, and the ulnar nerve supplies the flexor carpi ulnaris, part of the flexor digitorum profundus, and intrinsic hand muscles, as well as the skin of the medial aspect of the hand, wrist, and those that control wrist and finger flexion. You might be more familiar with the ulnar nerve if you've ever hit your funny bone, okay, and get that tingling sensation that runs from the medial side of your elbow all the way up your little finger, okay. The radial nerve innervates the extensor muscles of the wrist, the supinators, and the posterior skin of the limb. At this point, we should discuss something known as Hilton's Law, all right, which states that if a nerve innervates a muscle that crosses a joint, it also innervates the skin and connective tissue over that joint. And this is one of the reasons you can use the sensory map of the body as a way to infer the muscles that are innervated by those same nerves, okay, to a certain extent. The lumbar plexus comes from L1 through L4, and it innervates the thigh, the abdominal wall, the psoas muscle. The femoral nerve innervates the quadriceps and the skin of the anterior thigh and the medial surface of the leg. And the obturator nerve passes through the obturator foramen and innervates adductor muscles. Okay, so there's a mnemonic that goes with this. It's a little off color, but it works. And it's I twice get laid on Fridays. The I twice stands for the iliohypogastric and ilioinguinal. The get laid stands for the genitofemoral and lateral femoral cutaneous. And on Fridays stands for the obturator and the femoral nerves. Okay? So it's another way to remember the nerves, the critical nerves that come off of this plexus. The sacral plexus comes from L4 through S4, and it serves the buttock, the lower limbs, the pelvic structures, and the perineum. The major nerve here is the sciatic nerve, which is the longest and thickest nerve in the body, which innervates the hamstring muscles, the adductor magnus, and most of the muscles in the leg and the foot. And it's actually made of two nerves, the tibial and the common fibular. Okay? The mnemonic that goes with this particular plexus is cut fast through silly putty, which stands for common fibular, then tibial, and silly, which is sciatic, putty, which is pudental, okay, and the posterior femoral cutaneous is not a nerve that I usually test on, okay, so it's not in the mnemonic. The ventral rami in the thorax are a segmental pattern that form intercostal nerves supplying the intercostal muscles and the muscle and skin of the anterior lateral thorax and the abdominal wall. They also give off cutaneous branches to the skin along its course, while the dorsal rami innervate the posterior body trunk. One of the things we want to be familiar with is the concept of a dermatome, which is an area of skin that's innervated by cutaneous branches of a single spinal nerve. All spinal nerves, with the exception of C1, participate in dermatomes. The extent of spinal cord injuries is ascertained by the dermatomes that have lost sensation. However, most dermatomes overlap, so the destruction of a single spinal nerve does not necessarily cause complete numbness in a region of the body. This is of particular importance when you're applying anesthetic in order to do an operation. An example is those individuals that have to have their knee worked on. When they do knee surgery, they need to hit dermatomes L3, L4, and L5. So they're going to go after those particular spinal nerves, numb those spinal nerves in order for you to lose complete sensation through the area that overlaps the knee so they can operate on it without you perceiving extreme pain. Okay. Um, the Hilton's law that we discussed earlier can be used as a way to help you memorize the area of the body that has a sensory region associated with a particular nerve, as well as the muscles that are served by that nerve. Okay, so the law simply states that any nerve serving a muscle that produces movement in a joint, so that muscle crosses the joint, is also going to innervate the joint itself and the skin over the joint. All right, so you can use the sensory map as an approximation of the muscles that are innervated. Okay, and we'll see that map in an adjoining segment. Okay, I will grab that for you so you can see it real quick. So what you can see here in this figure is just a look at the sensory map for the nerves that come off of the different plexuses. There's cervical up top, brachial here, right? It's color coded, okay? Lumbar here, sacral down here, and then the muscles that are part of this as well, okay? And again, color coded to match the nerve that we're talking about. So see how the green, for instance, for the obturator and lateral femoral cutaneous are going to correspond to the femoral and the obturator nerve here. Okay, so you can use this as an approximation, right? Same for the axillary nerve up here, and the region of the axillary nerve that serves as sensory. Okay, so that's just to bring home this idea that you can use Hilton's law as a way to intuit or make a reasonable guess as to the muscles that are innervated by a particular nerve. And remember that the names on these nerves usually give you a clue as to their location, right? And that helps you with knowing what the targets are. Okay, for instance, the obturator nerve goes through the obturator foramen of the pelvic girdle, all right, and it runs medial, right? So it's going to hit a lot of adductors of the thigh, but it also provides sensory to that region as well. Okay, so keep that in mind when you're trying to remember. It's a nice way to sort of cut down on the amount of brain power you have to dedicate to doing the memorization. Right? Okay, I'll see everybody in the next podcast.